As we close out another year dominated, at times at least, by the COVID pandemic, we are taking a closer look at the health stories and the trends that could define the year ahead. 2022 saw the rollout of the antiviral drug Paxlovid, along with variant-specific vaccines to fight COVID. We also witnessed a worldwide outbreak of Mpox and the resurgence of polio in parts of New York State. And right now, Americans are battling an unusually early RSV and severe flu season. CBS News medical contributor Dr. David Agus joins us now with more on all of this. Dr. Agus, let's begin with the COVID conversation, which I think waned as the year went on. People began to move on. There was a new normal. The president said it was over. What can we expect in the new year?
So the good of this year, right, is that the vaccines have held. So unfortunately, over 15% of people in the United States, we're number 70 in the world in terms of boosters. 15% of people have gotten this new bivalent booster, not enough. 6+ months out, you need to get it. And so what we're going to see is if we can keep the booster rate up, I think we're going to be okay in the year ahead. If we don't, we're going to start to see more and more people getting sick because COVID numbers are going up across the country with the new variant. The vaccine works against serious illness, but we have to stay on our toes.
But that's what's so frustrating to people, Dr. Agus, because you get vaccinated, you do all the right things, and you still get COVID. And we're still dealing with it.
You do, but you don't get that ill.
Is that ill?
Yeah. And you're not being hospitalized. But you're right. We're praying in 2023 that we will get a vaccine or a booster that will block spread and symptomatology with this virus. That'll increase what we call mucosal immunity to actually give us protection, which the current ones protect against serious illness, but not this.
When we were in the thick of COVID and fighting against it, it seemed like we kept hearing the narrative that we weren't as prepared as we should have been.
Yeah.
Are we now more prepared for the next pandemic?
I better hope we are, or we're in trouble. I mean, so a pandemic by definition means we don't know what's going to happen. And I think we now have systems in place that we're going to be better. We're going to be better collecting data, which we didn't do well during COVID. We're going to have manufacturing ready for vaccines and small molecules, these antivirals. And we've been normalized that if we have to wear a mask, we will wear a mask. And we know the behaviors. Remember in the beginning about touching surfaces, about 6 feet and about all those things?
Right.
We were normalizing these ideas which are here. So we're going to be better with a new virus. Look at Mpox or the old monkeypox. It's had it came up and then we were able to deal with it. A little bit slow, but we dealt with it rather well in this country.
Right.
I think we're going to be a lot better in the year ahead.
Yeah, so we had Mpox, we had RSV, severe flu season.
Polio.
Resurgence of polio.
It's like the 10 plagues.
Yes. So do you think that this is our new normal, dealing with these viruses? Is this really what life is now? We have to adjust to that.
Yeah.
Because I'm trying to figure out when should you freak out and when should you not?
No, you freak out based on your pre-existing conditions, right? So the only people being hospitalized now with COVID are elderly or people with medical conditions. Get this figure, 94% of our country has already had COVID-19.
Wow, 94%? We've all had it. Have you had it?
I have had it in August, and so I am not a novice. We've all been exposed to it, so we all have some immunity. You couple that with the vaccines, we're in a pretty good spot. But obviously, we have to keep that up with the boosters, which is unfortunate, and nobody wants it, but we have to do it.
So medicine is one of those fields that seems to be like right next door to just pure magic, right? Things that come out of the field do miraculous things, or it feels that way anyway. Like my daughter got a little eye infection, the doctor gives you drops, it clears up in like 2 days. With that kind of as prelude, what are you excited about in this year and also looking ahead for next year in terms of advancements?
Yeah, give us some good news because we need it.
All right, so the good news is I think every parent in this country that is watching today, their shoulders will come down when I tell them this, is that very soon we're going to have an RSV vaccine. So the data look fantastic. It should be approved by the FDA for, get this, mothers. So when you're pregnant, we give it to you. And when your baby's born, the first 6 months, they have the protection. And then for young children and elderly. And that's a big one there, right? We're seeing now hospitalizations across the country from RSV. Pediatric ICUs full. And we're going to now be able to vaccinate pregnant women and others with this vaccine. And that's a big one. The other one that I'm really excited about is big data. Artificial intelligence, or AI, is going to enable us to care better. They're going to be able to read our scans, our pathology reports, look at things to enable every person in the country to get the best care. So right now you may have a remarkable doctor in a hospital in New York City. What AI will do will make every doctor, good doctors, great. And that's going to be the new era. We've normalized using data, hopefully during COVID. And so I think that's going to be a big thing. And it's going to be cost effective everyone's going to be able to do this, and it's really going to improve care across the country. So that I'm excited about.
Right. Yeah, and your enthusiasm, I have to say, is infectious. You were on this show earlier this month talking about your new show, The Checkup, which is on Paramount Plus. Number one, I have to say again, it's knockout. I love how you do it. You're so good at it, where you're just talking to celebrities who are having problems like we all do. Very well done. So that's good news. Other good news, you in that friggin' green sweater. Can we just have an acknowledgement that he's wearing something other than black?
There we go.
And it looks good on you. How's it feel? Are you wincing? Are you cringing? How are
No,
you
I
feeling?
can handle it. I mean, you have to realize I'm about to go on, and then the remarkable team here at CBS Mornings said, well, we happen to have something in Nate's closet that will go better with Christmas morning.
Yeah,
and
you
so
look great.
thank you, Nate, for sharing your clothing.
It may look like it's a fit for Nate, but in fact, that was
Tony.
my
It was Tony's closet.
That's all right.
Tony's
We get
closet,
confused
yes.
all the time.
Yeah.
No, it was Tony's closet, and I appreciate you sharing.
It looks
Yes.
like you can't wait to take it off.
It's working on you. It's working
Keep the
on you.
tag
Dr.
on,
Agus.
okay? All right,
Thank
go
you,
back.
sir. Thank you.